Well, May is Arthritis Awareness Month, and we're back with today's checklist, tackling just that, including some symptoms to watch out for and pain management as well. We brought in not one but two experts to help us. NBC News medical contributor Dr. Natalie Azar and board-certified clinical specialist in orthopedic physical therapy, Karena Wu. Good morning to both of you ladies.
Good morning. Good morning.
Dr. Azar, I mean, listen, I knew arthritis was widespread. I had no idea 60 million Americans are living with some form of arthritis, but there are lots of different types.
There are actually over 100 different types of arthritis, which even to a rheumatologist, that sounds like a lot, because I think we've heard a lot of the most common types. For example, osteoarthritis happens to be the most common type. It's also known synonymously as wear and tear or degenerative, the kind of arthritis you get as you get older. And it does affect women more than men. In fact, most types of arthritis do affect women more than men. As opposed to osteoarthritis, we have all the different types that, again, you probably have heard of: rheumatoid, lupus, psoriatic arthritis. Those are considered more inflammatory. Many of them are autoimmune diseases. Not exactly what we're going to focus on today.
But why are more women afflicted with arthritis than men?
So honestly, it has to do partially with biology and hormones and what our anatomy actually makes a big difference in terms of like knee arthritis, for example, as we get older.
So you know my bout with arthritis in my back. It took a while to determine it's arthritis. How do you know the difference between that and just common aches and pains?
Common aches and pains. So some of the sort of cardinal signs and symptoms that we attribute to arthritis include stiffness, swelling, pain, warmth, redness, and difficulty moving a joint. But I think the challenge that we have as docs who are taking these patients in and trying to figure out what's ailing them, it all has to do, Dylan, with taking a really, really detailed history, doing a very thorough physical exam, doing labs, as well as imaging in certain cases to establish a diagnosis. As I mentioned before, when we talk about the different types of arthritis, some of these things are, things that happen within a couple of days that generates a very different, what we call differential diagnosis, than something that's been going on for weeks and weeks and weeks.
You obviously, I guess there's really no cure for arthritis, but you can manage the symptoms?
You can manage the symptoms, and we were talking about this too. Like a cure technically would be a joint replacement, right? But other than short of being able to cure, we can control people's symptoms. Over-the-counter medicines, although Tylenol is not strictly endorsed by the American College of Rheumatology for arthritis pain, it does still help some people. It doesn't quite pack the same punch as an anti-inflammatory like Advil or Motrin, which also can be used topically. It's a little bit safer than taking by mouth. We do definitely endorse certain anti-inflammatory supplements like turmeric, fish oil, SAMe, things like that can actually help with people's symptoms. There are loads of prescription medications that I'm sure many of you have seen commercials for. Diet and exercise, I can't emphasize enough how important those two interventions are, and sometimes outperform medications, especially for osteoarthritis. And of course, there's tons of different injections that we also do.
All right, Dr. Natalie, thank you. Mr. Roker.
Hey, so you talk about exercise. Well, Dr. Karena Wu is an orthopedic physical therapist. So, Karena, when you're trying to exercise and that arthritis pain gets in the way, is that kind of an indication that maybe PT is right for you?
Yes. So when you are supposed to be seeking out your healthcare provider is when you've got a lot of pain that's unchanging and constant. You start getting super stiff and you start getting limited in daily tasks like getting out of bed, walking, stair climbing, bending. That's when you need to schedule. Physical therapy is going to help you with reducing pain and inflammation, increasing mobility, circulation, improving all sorts of stability, strength, and flexibility. Right. So physical therapy should include manual therapy plus exercise because multiple research studies show that has superior outcomes, and it should also include modalities like ice, heat, laser, ultrasound, kinesiology, taping, cupping. All of those things will help with physical therapy to help with arthritic symptoms.
So what are some of the other wellness modalities we can look at?
Yes, so wellness therapies. Things like stem cell injections and PRP injections. These are injections. Stem cells and PRP are both specialized cells. Stem cells are going to be coming from bone marrow. That's the most studied. PRP is platelet-rich plasma. That's coming from the blood. Both of those get injected back into you. They're withdrawn from you, and they help with growing and regenerative medicine, so that's cellular healing from the inside. Acupuncture is using needles like the diameter of your hair. Okay, that's the thickness of the needle. It's going to be Eastern or Western, so it's systemic or local, but acupuncture is phenomenal with pain reduction and reducing inflammation, helping bring energy and
you've got massage and Pilates.
Circulation.
And then when you get to personal training, should you be seeking out somebody who is specialized in kind of in a physical therapy, physical training.
Yes, absolutely. With Pilates personal training, you want a tailored program that's working on your deficits. You need to strengthen the isolated muscles, plus your kinetic change. So all of these will help with arthritic symptoms.
Great advice. Karena, thank you so much, and Dr. Azar as well. And a reminder, if you don't already have the Start Today app, Karena is one of our Start Today trainers, has a fantastic program focusing on mobility and reducing back pain. Just scan the QR code, download the app for an annual subscription. Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.